handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Okay, now, so let's go to the abdomen. Okay? So before we go to the specific structures, let's discuss first the abdominal wall. Okay? So ito yung mga madalas nang itanong ng surgeon, no? Anong layer na tayo? Okay? So your anterior abdominal wall, okay, is first, okay, most external, okay, the most external is the skin, followed by the superficial fascia, followed by the deep fascia, okay, followed by the muscle, and an extraperitoneal fascia, okay, until we encounter the parietal peritoneum. Okay? Yung skin, we already discussed in the first part of this discussion. Okay? So we'll go straight to the superficial fascia. Your superficial fascia, okay, is still further divided into two. Okay? You have a superficial fatty layer, okay, or what we know as the Camper's fascia. So it is continuous over the inguinal ligament, okay, and to merge with the superficial fascia of the thigh, and over the perineum, okay, to continue as the superficial perineal fascia. So basically, it is the fatty layer. The fatty layer is the Camper's fascia. Okay? So ito ang skin. Okay? This is the Camper's fascia or Camper's layer. Okay? Camper's layer. It is followed by a deep membranous layer, also known as the Scarpa's fascia. Okay? Scarpa's fascia. Your Scarpa's fascia, okay, is continuous, no, over the pubis and perineum, okay, as the membranous layer of the superficial perineal fascia. Okay? It has a proper name. Okay? It is the Colles fascia. Okay? In the abdomen, it is Scarpa's fascia. In the pubis and perineum, it will now be the Colles fascia. Okay? It is also continuous over the penis, no? And it will now be called the dartos muscle. Okay? Pubis and perineum, Colles fascia. Over the penis, dartos muscle. In the abdomen, Scarpa's fascia. Okay? So the deep membranous layer. So this is the skin, okay? Followed by the superficial layer of the superficial fascia, the fatty layer, the Camper's fascia, okay? Followed by the membranous layer, okay, ayan. This is the Scarpa's fascia. Okay, so after the superficial fascia, okay, we have the deep fascia, okay, which covers the muscles, and it is continuous with the spermatic cord at the superficial inguinal ring. Okay? So at the spermatic cord, it will now be called the external spermatic fascia. External spermatic fascia. Okay? While over the penis, the deep fascia will now be called the box fascia. Okay? At the penis, it is box fascia. Okay? So, another important structure in your abdomen is your rectus sheath. Okay? It is formed by the fusion of the aponeurosis of the external oblique, internal oblique, and the transversus abdominis. Okay? So, it will contain the rectus abdominis, okay, and sometimes the pyramidalis. Okay? And the clinical significance is that it will contain the superior and inferior epigastric vessels together with the thoracic nerves 7 to 12. Okay? So there will be differences, okay, if you are above and below the arcuate line. Okay? Above the arcuate line, okay, anteriorly, you have the external and internal oblique muscle aponeurosis. Okay? And posteriorly, you have the internal oblique and transverse muscle. So, nag-split yung internal oblique to cover the anterior and posterior surfaces. Okay? Anterior and posterior layers. However, below the arcuate line, all of the aponeurosis, okay, are seen anteriorly. No? Below the arcuate line, lahat na aponeurosis, external oblique, internal oblique, and transversus muscles, nasa anterior na sila. Okay? And then sa posterior, only the transversalis fascia is present. Okay? So this is the rectus sheath above the arcuate line. Okay? Sabi natin, the rectus sheath will cover the rectus abdominis. Okay? So ito yung rectus abdominis mo. Okay? Sabi natin, anteriorly, you have the external oblique and internal oblique. Okay? Ayan, no? And then posteriorly, you have the internal oblique and the transversus abdominis. Okay? So, yan. Nag-split si internal oblique na to cover anterior and posterior parts. However, what happens if you are below the arcuate line? Okay? Below the arcuate line, okay, ito na lang, no? Lahat ng aponeurosis ay nasa anterior na. Okay? Ay nasa anterior. Okay? Behind, wala nang aponeurosis. It will only be the transversalis fascia. Okay? So, that's the difference if you are above and below the arcuate line. Okay? Now, let's go to the inguinal region. Okay? So, the inguinal region, okay, one triangle that we need to discuss is the inguinal triangle or Hasselbalch's triangle. Okay? It is an area of potential weakness. Okay? And it is the site of direct inguinal hernia. Okay? It is the site of direct inguinal hernia. So, what are the boundaries of your Hasselbalch's triangle? Okay? Let's look at the picture na lang, no? The boundaries are, ayan, no? The linea semilunaris or the lateral border of the rectus abdominis. Okay? Inferiorly, you have the inguinal ligament. Okay? And laterally, you have the inferior epigastric vessels. Okay? So, this portion is the inguinal or Hasselbalch's triangle. Okay? So, this portion, okay, diyan nangyayari ang direct inguinal hernia. Okay? So, you also have the inguinal canal. Okay? Your inguinal canal is an oblique passage through the lower part of the anterior abdominal wall. Okay? What's the clinical importance? No? It will transmit the spermatic cord in males or the round ligament of uterus in females. Okay? And the genital branch of the genitofemoral nerve. Okay? So your inguinal canal will begin at the deep inguinal ring and it will end at the superficial inguinal ring. Okay? And lies directly above the inguinal ligament. Okay? So ito siya. So this is the deep inguinal ring. This is the superficial inguinal ring. Okay? So yung canal, okay, that passed through over them. Okay? Ayan, that's the inguinal canal. Okay? So your inguinal canal, okay, so the entry is the deep portion, okay, or the deeper opening is the deep inguinal ring, okay, and the more external opening is the superficial inguinal ring. Okay? So your deep inguinal ring is an oval opening, okay? In contrast to your superficial inguinal ring, it is triangular in shape. Okay? Your deep inguinal ring is part of the fascia transversalis, while your superficial inguinal ring is part of the external oblique aponeurosis. Okay? So your deep inguinal ring lies above the inguinal ligament, midway between the ascis and the symphysis pubis, and lies lateral to the inferior epigastric vessels. Okay? So this is your inferior epigastric, this is your deep inguinal ring. This is your inferior epigastric vessels, no? So it lies lateral. This is your symphysis pubis. This is your ascis. So midway, okay, nandun ang deep inguinal ring. Okay? While your superficial inguinal ring lies immediately above and medial to the pubic tubercle. So nandito yung pubic tubercle. Ito yung superficial inguinal ring. Okay? Your deep inguinal ring, okay? Its margins, the margins of the ring will give attachment to the internal spermatic fascia. Okay? While your superficial inguinal ring will give attachment to the external spermatic fascia. So, what are the boundaries, no, of your inguinal canal? Okay? Anteriorly, you have the external oblique and internal oblique aponeurosis. Posteriorly, okay, you have the conjoint tendon and the fascia transversalis. Superiorly, you have the internal oblique and the transversus abdominis. Okay? And inferiorly, you have the inguinal ligament and the lacunar ligament. Okay? So those are the boundaries of your inguinal canal. Okay? So let's now go to the peritoneum. Okay? Your peritoneum is a thin serous membrane that lines the walls of the abdomen and the pelvis, no? Abdominal and pelvic cavities, and clothes the viscera. Okay? Just like your pericardium and your pleura, no, it has two layers. Okay? A parietal layer and a visceral layer. Okay? Similarly, the parietal layer will line the abdominal and pelvic cavity. Okay? While the visceral layer is closely attached to the organs. Okay? Just like other coverings in the body, okay, the parietal layer is innervated by the somatic nerves. Okay, while your visceral layer is innervated by the visceral nerves. Hence, they are insensitive to pain. So the red portion is your parietal peritoneum. Okay, the blue portion is your visceral peritoneum. Okay, and the portion or the cavity in between is the peritoneal cavity. So, the peritoneal cavity is the potential space between the parietal and visceral layer. Okay, in males, it is a closed cavity. However, in females, no, there is communication with the external environment through the uterine tubes, uterus, and the vagina. Okay? So, your peritoneum has several ligaments. Okay? Okay, the peritoneal ligaments. Okay? The peritoneal ligaments are two layered folds of peritoneum that connects a solid viscera to the abdominal wall. Okay? And each solid viscera has a different name, no? Just like this one, no? Your ommenta or omentum. You will name it omentum if it is a fold of peritoneum that connects the stomach to another viscous. Okay? If it is the stomach connecting to the other organ, ommenta or omentum ang tawag natin dyan. So for example, the greater omentum, the lesser omentum, or your gastrosplenic omentum or ligament, okay, which connects the stomach, gastro, no, to the spleen, splenic. Okay, gastrosplenic omentum. So, this is your greater omentum. Okay, your greater omentum, kaya siya greater, it is attached to the greater curvature of the stomach. Okay, and to another viscous, which is the transverse colon. Okay, it hangs like it hangs down like an apron in front of the coils of the small intestine. Okay, and functions to transmit the right and left gastroepiploic vessels. Okay, these vessels will supply your greater curvature. Okay, one unique function para siyang abdominal police, no, because it adheres to the areas of inflammation, thereby limiting the spread of infection or inflammation, no. So it prevents serious diffuse peritonitis. So this is your stomach, okay? This is your greater curvature, okay? So this is your greater curvature. Asaan yung greater omentum? Ayan. Okay? So it double layer siya, okay? It transmits down the left and right gastroepiploic vessels. So ito 'yan, no? Okay? Ito yung vessels na yan. It will supply the greater curvature. Okay? So hangs down like an apron. Okay, it will cover the intestine. Ayan, nandyan. And then, eventually, coconnect siya dun sa transverse colon. Okay, that's the greater omentum. Your lesser omentum, on the other hand, okay, is attached to the lesser curvature, okay, to the undersurface of the liver. Okay, it forms the anterior wall of the lesser sac of the peritoneal cavity, and this time it will transmit the left and right gastric vessels. Okay, so these vessels will supply the lesser curvature. Okay, asan si lesser omentum? Sabi natin, lesser curvature to the liver. So, ayan siya. O siya daw ang anterior border ng lesser sac. Okay, this is your greater omentum. Ayan. Okay, so aside from the omentum, we also have mesentery. Okay, mesentery naman ang name if you are referring to fold of peritoneum that connects the intestine. No? If it connects the intestine to the posterior abdominal wall. Okay? If we are referring to intestine, it's mesentery. If it is stomach, omentum. Okay? So it will contain the superior mesenteric and intestinal vessels, nerves, and lymphatics. Okay? Examples of mesentery are, ayan, mesentery of the small intestine, the transverse mesocolon, sigmoid mesocolon, the mesoappendix. Okay, asan yan? Ito, no? The mesentery. Dito yung transverse mesocolon. Ayan. Mesentery of the small intestine. Dito, meron tayong mesoappendix. Ayan, etc. Okay, so after the peritoneal ligaments, let's talk about the peritoneal cavity. Okay, so your cavity is divided into two. Okay, you have a lesser sac and a greater sac. Okay, the lesser sac, okay, other name is omental bursa. The lesser sac, other name is omental bursa. It lies behind the stomach and the lesser omentum. Okay, it is behind the stomach and lesser omentum. Okay, and extend upward as far as the diaphragm. Okay, and downward between the layers of the greater omentum. Okay, your lesser sac has a connection to the greater sac. Okay, through this opening, no? The opening of the lesser sac. Okay, okay. Other name is epiploic foramen or foramen of Winslow. Okay, or foramen of Winslow. Asan siya? The lesser sac, sabi natin, behind the stomach. Ayan, ito. And behind the lesser omentum. Okay, andun siya. Okay, the epiploic foramen, okay, is this one, no? The connection between the greater sac and the lesser sac. Okay, sabi natin, the lesser sac as far back as the diaphragm. Okay, down to the, ayan, this portion of the greater omentum. So, this is the lesser sac. This is your stomach. Okay, so your lesser sac is behind the stomach. Okay, this is the foramen of Winslow or the epiploic foramen. So, connection between the greater and lesser sac. Okay, this, the red and yellow portion is the greater sac naman. Okay, the greater sac is the main compartment. Okay, and extends from the diaphragm. This one is the diaphragm. Okay, down to the pelvis. Okay, that is the greater sac. Okay, so this is the lesser sac behind the stomach. Again, the connection, epiploic foramen of Winslow. The rest, okay, is part of the greater sac. Okay, so ayan, we already mentioned the epiploic or omenta foramen or foramen of Winslow. It is the natural opening between the lesser and greater sacs. Okay? It has boundaries, no? Meron siyang boundaries. Okay? And best represented by this, no? By this diagram. Anteriorly, okay? Anterior to the epiploic foramen, okay? You can see the portal triad, okay? Which is consists by the bile duct, the hepatic artery, and the portal vein. Okay, together with the free border of the lesser omentum. Okay? So, ayan, no? Ito, free border ng lesser omentum. Okay? Posteriorly, you can see the inferior vena cava. Superiorly, you have the caudate process of or caudate lobe of the liver. Okay, and inferiorly, you have the first part of the duodenum. Okay, so those are the boundaries of your epiploic foramen. Okay, so now let's go to each organ in your abdomen. Okay, so to start with the stomach. Okay, it is the most dilated portion of the alimentary canal, roughly J-shaped in appearance. Okay, situated in the upper part of the abdomen, okay, beneath the left costal margin, and it occupies the epigastric and umbilical region. Okay, it is intraperitoneal, no, covered entirely by the peritoneum. Okay, it is relatively fixed at both ends but mobile in between. Okay, so this is your stomach. Okay, the first part is your fundus. Okay, so this part, okay, it is the dome-shaped part of your stomach projecting upwards. Okay, usually full of gas, no? So yung mga biniburp natin ang galing sa fundus, no, ng stomach. The body, okay, it extends from the cardiac orifice, okay, up to the level of incisura angularis, so this portion. Okay, so this portion will be the body of the stomach. Okay, it is followed by the pyloric antrum. Okay, it extends from the incisura angularis to the pylorus. Okay, so this part is your pyloric antrum. The most tubular part is your pylorus. Okay, it is guarded by a circular muscle known as the pyloric sphincter. Okay, it is anatomic and physiologic sphincter. Okay, and the cavity within the pylorus is the pyloric canal. Okay, the borders, you have the right border, okay, here, that is the lesser curvature. In the left border, okay, it is a larger border, no? That is your greater curvature. Okay, you have two orifices, okay, in your stomach, okay? Yung mga ang entry is your cardiac orifice, no? Where the esophagus enters the stomach, and the exit is the pyloric orifice. Okay, again guarded by the pyloric sphincter. Okay? So your stomach, no, it enjoys a bed, no? Sana all nakakahiga, no? So your stomach has a bed, okay? Comprised of several structures, okay? Which includes your pancreas, ito, no? Stomach bed. It includes your pancreas, your spleen, your left kidney, okay? With the adrenal on top, okay, and the transverse mesocolon in the diaphragm. Okay, so that comprises your stomach bed. Okay, another picture here is yung dotted lines yung stomach natin. Okay, so kasama ang pancreas, the spleen, left kidney, left adrenal, the transverse mesocolon, and the colon itself, and the diaphragm. You will see this image in your handout, no? But basically, this will be the blood supply of your whole gastrointestinal system, okay? So we'll discuss further later, but this is the algorithm. Algorithm ang tawag dyan, okay? So, coming from the abdominal aorta, di ba, na-remember, you have three anterior visceral branches. Okay, we have the celiac, superior mesenteric, and inferior mesenteric artery. Okay, since we are in the stomach, okay, mainly, the blood supply of the stomach will be coming from your celiac artery. Okay, so the stomach, the arteries are derived from the branches of your celiac artery. Okay, so your left gastric artery will supply the lower third of esophagus. Okay, naalala pa natin, the lower third, no? Okay, and the upper right part of the stomach, which is your upper half ng lesser curvature. Your right gastric artery will supply the lower half ng lesser curvature. Your short gastric arteries, okay, will supply the fundus. The left gastroepiploic artery will supply the greater curvature, upper part. and the right gastroepiploic artery will supply the lower half ng greater curvature. Okay? Baka malito, no? Greater or lesser curvature. Okay? Basta pag gastroepiploic, no? Mas marami siyang letters, no? Mas maraming letters compared sa gastric. So, mas maraming letters, greater, no? Sa greater ang sinusuplayan niya. Okay? So, this is the picture, no? So, again, the blood supply, no? Will all come from the celiac trunk. Okay? So, sabi natin, okay yan. The left gastric artery, upper half ng lesser curvature. Okay? Upper half ng lesser curvature. Okay? Yung lower half ng lesser curvature, okay, is coming from the right gastric, which is a branch of the hepatic artery. Okay? Your fundus, okay, your fundus is supplied by the short gastric artery, which is a branch of your splenic artery. Okay? Yung upper half ng greater curvature is supplied by the left gastroepiploic artery, which is a branch of your splenic artery. Okay? While your lower half ng greater curvature is supplied by the right gastroepiploic artery, which is a branch of your hepatic artery. Okay? Which is a branch of your gastroduodenal, which is coming from your hepatic artery. Okay? So that is the blood supply of your stomach. Very favorite yan. Okay? Always remember that. Okay? Venous drainage was also asked, no, in the previous exams. Okay? So, the veins will ultimately drain into the portal circulation. However, okay, only the left and right gastric vein will drain directly into the portal vein. Okay? Your short gastric vein and left gastroepiploic vein, okay, will join first the splenic vein, okay? And remember, your splenic vein, okay, is a component of your portal vein. So, short gastric and left gastroepiploic, join muna sa splenic, okay? Yung splenic will form the portal vein. While your right gastroepiploic, okay, will join naman the superior mesenteric, okay? And eventually, your superior mesenteric will form the portal vein. Okay? The lymph drainage, okay, will eventually drain into the celiac nodes, okay? And the blood supply is coming from the celiac plexus and the vagus nerves. Okay? So that is all about the stomach. Okay, now let's talk about after the stomach, the duodenum. Okay? So this is your duodenum. Okay? So the first part is at the level of L1. Okay? The second part, no, will span from L1 to L3. Okay? By the way, the first part is the superior part. The second part is the descending part. Okay? The third part is the horizontal part. And the fourth part is the ascending part. Okay? So, yung second part, L1 to L3. Yung third part is at the level of L3. Okay? While your fourth part, okay, will span from L3 going up to L2. Okay? So, yeah. So, as mentioned, no? The longest is the descending part, no? Around 7 to 10 cm. Okay? So, these are the peculiarities of each segment. The first 2 cm has a mesentery and is therefore mobile. Okay? The only mobile part of the duodenum is the first part. Okay? Previously asked, no? In the board exam. Okay? Your first part is otherwise known as the ampulla or the duodenal cap. Okay? And it is the part that is attached to the hepatoduodenal ligament and the greater omentum. Okay? Your second part, okay, is the one that receives, no? Or the one that is pierced by the bile ducts and the main pancreatic ducts. Specifically, the medial wall. Okay? So, it will receive the bile. The second part of the duodenum. Okay? And also, the second part, it is the one that curves around the head of the pancreas. Okay? It is the one that is curved around the head of the pancreas. The third part is the one crossed by the superior mesenteric vessels. Okay? And the fourth part, okay, doon nag-attach si suspensory muscle of the duodenum or otherwise known as ligament of Treitz. Okay? So that is the landmark wherein the duodenum, okay, is transitioning to be the jejunum. Okay? The demarcation between the duodenum and jejunum is the ligament of Treitz. So this, nakat yung first part, no? This is the second part. Yan, no? Curved around the head of the pancreas. Tama? Okay? The third part is the horizontal part. Okay? It is crossed by the superior mesenteric vessels. Yan. Okay? Wala tayong ligament of Treitz dito, na? So this is the ascending part. Okay? So going to the to the jejunum, no? Jejunum and ileum. Okay? Combined, it is 20 feet long, okay, or 6 meters long, okay, and it begins at the duodenojejunal flexures, okay, and it will end at the ileocecal junction, okay. It has a mesentery, no, walang proper name, no, okay, it is just called the mesentery of the small intestines, okay. Ito ang usually favorite, no, ipag-compare jejunum versus ileum, okay. Jejunum versus ileum. Your jejunum comprise the proximal 2/5, okay, while your ileum is the distal 3/5. Okay, so ileum is longer. Okay, the ileum is longer. Okay, your jejunum occupies the upper part of the peritoneal cavity. Okay, below the left side of the transverse mesocolon, while your ileum occupies the lower part of the peritoneal cavity, pelvis, and right lower quadrant. Okay? Your jejunum is emptier. Okay? Walang laman masyado. It is larger in diameter. Okay? It has thicker walls and redder in appearance. Okay? In terms of plicae circularis, your plicae circularis are horizontal folds, no? Horizontal mucosal folds that you can see grossly. Okay? So, the plicae circularis in jejunum are larger, taller, more numerous. Okay? However, in the ileum, they are shorter, okay, and widely separated. And eventually, okay, it will be absent in the lower part. Okay? So, your jejunum has less prominent arterial arcades, only 1 to 2, with longer vasa recta, scanty fat deposition, and no Peyer's patches. Okay? Dahil konti lang yung arterial arcades niya, maraming spaces, no? That's why you will have translucent areas, okay, called windows. Okay? On the other hand, your ileum has more arterial arcades, 3 or more. Shorter vasa recta, okay? It has more fat, and it has Peyer's patches. Okay? So, anong itsura nila? Ayan. So, jejunum, konti lang ang arterial arcades, pero yung vasa recta niya longer, no? Okay? Tapos, maraming spaces in between, no? Kaya merong translucent areas known as windows. Okay? Tapos, konti lang yung yellow niya dito, no? Ibig sabihin, konti lang ang fat. Okay? While your ileum, maraming fat. Okay? Maraming arterial arcades. Okay? Yung vasa recta, shorter. Yan. Okay, so that is your ileum. Okay, similarly, ayan, jejunum has longer vasa recta. Your ileum has shorter vasa recta. Okay, as mentioned, your plicae circularis, okay, other name niya is valves of Kirkring or valvulae conniventes or horizontal mucosal folds. Okay, so these are horizontal folds that can be seen grossly. Okay? And composed of submucosa and a mucosa. Okay? It is mostly developed in jejunum. Okay? And it is absent in the duodenum and distal half of ileum. Okay? In terms of blood supply, venous drainage, lymphatic drainage, and nerve supply, everything is all about superior mesenteric. Okay? Superior mesenteric artery, vein, nodes, and plexus. Okay, now let's go about this table. Okay, so this table, okay, has the complete details about your uh, intestines or GIT, starting from your cecum, okay, all the way down to your lower half of your anal canal. Okay, so again, we'll not discuss everything. We'll highlight lang, no, the important parts. Okay? So, yung lengths, okay, na-discuss na natin before, no? Hindi na natin di-discuss this moment. Okay? So, your cecum will start at the ileocecal junction. Okay? And then, up to the part of the ascending colon. At the cecum, specifically, at the posteromedial surface, okay, you have the appendix. Okay? Your ascending colon will start, okay, at the end of the cecum, okay, to the right colic flexure, okay, while your transverse colon, okay, spans from the right colic flexure to the left colic flexure. Okay? Your descending colon, okay, will cover from the left colic flexure up to the pelvic brim. Okay? And then once it is at the pelvic brim, it will become the sigmoid colon. Okay? And remember, the end of the sigmoid colon is at the level of S3. Okay? S3. Okay? So at the level S3, it will become the rectum up to the tip of coccyx. Okay? And then eventually, it will become your anal canal. Okay? So your cecum occupies the right iliac fossa. Okay? Your appendix also occupies the right iliac fossa. Okay? And the base is best located at the McBurney's point. Okay? Your ascending colon is at the right lower quadrant. Okay? While your transverse colon, okay, is in the umbilical region. Your descending colon is in the left upper and left lower quadrant. Okay? While your sigmoid and rectum will occupy the pelvis, okay? And your anal canal is at the perineal region. Okay? At the perineal region. So, important to note which structures are intraperitoneal, extraperitoneal, and retroperitoneal. Okay? So, for this case, okay, cecum, appendix, transverse colon, and sigmoid colon has complete covering. So, all of them are intraperitoneal. Okay? Your ascending colon, descending colon are retroperitoneal. Okay? Ascending and descending colon, front and sides lang, no, ang may peritoneal covering. That's why it's retroperitoneal. While your rectum, okay, the proximal third ang may covering lang anterior and lateral. Your middle, anterior lang. So, yung proximal and middle third are retroperitoneal, while your distal third has no covering. So, the distal third is extraperitoneal. Okay? While your anal canal is extraperitoneal. Okay? So, in terms of blood supply, okay, I will just summarize, no? So, everything, okay, starting from cecum, up to the proximal transverse colon, all of them will be supplied by the superior mesenteric artery, veins, nodes, and plexus. Okay? So, up to the proximal part of transverse colon, superior mesenteric ang supply nila. Okay? Starting from the proximal part ng distal part ng transverse colon, up to the upper half ng anal canal, all of them will be supplied by inferior mesenteric artery, drained by the inferior mesenteric vein, okay, and inferior mesenteric nodes, and supplied by the inferior mesenteric plexus. Okay? So, starting from the distal transverse colon to the upper half of anal canal. Okay? And as you see, your anal canal lower half has a different supply drainage and nerve supply. Okay, your lower half is supplied by inferior rectal artery, which comes from the internal pudendal artery, no? Okay, which is a branch of the internal iliac artery. Okay, it is drained by the inferior rectal vein. Okay? Similarly, from the internal pudendal and internal iliac vein, okay, it is drained by the medial group of superficial inguinal nodes, okay, and drained by the somatic inferior rectal nerve. So your lower half of anal canal, okay, parang ano no, humiwalay siya no from the gastrointestinal blood supply, okay, and drainage, okay. So your lower half of anal canal is has a total different blood supply, venous drainage, lymph drainage, and nerve supply, okay. So that is basically the summary of this table, okay. So now let's try to differentiate the large intestine versus the small intestines, okay. Externally, your small intestines are more mobile, okay, and has a mesentery, okay. Most parts of your large intestines are fixed and retroperitoneal, except for some parts, okay. So basically, kaya siya small intestine, it has a smaller diameter. Your large intestine has a larger diameter, okay. In your large intestine, we can appreciate, okay, the longitudinal muscle that forms three bands known as the teniae coli. Okay, it is only appreciated in the large intestines. Okay, your large intestines has fatty tags, okay, named as the appendices epiploaceae. Okay, appendices epiploaceae, okay, are fatty tags that can be seen in your large intestines. Okay? Your large intestines also has sacculated walls, okay, known as hostra or hostration. So para silang mga longganisa. Okay? That is the large intestine. The plicae circularis, okay, yung horizontal mucosal folds can only be seen in your small intestine. Okay? The Peyer's patches, yung mga lymphoid follicles, okay, is a feature of your small intestine as well as the villi. Okay? The Paneth cells, okay, is also a feature of your small intestines. On the other hand, your large intestines, it has a more prominent or deeper crypts of Lieberkühn. Okay? Deeper crypts of Lieberkühn, and it has more goblet cells. So that's the difference externally and histologically. Okay, how will you remember? You just remember the mnemonic large. Okay? Large. L4, Lieberkühn crypts are deeper. Lieberkühn crypts are deeper. The appendices epiploaceae for letter A. For letter R, ang sasabihin mo, hostra. Okay? Letter R kasi yon. Letter R yung mnemonic dyan. Okay? Sa hostra. Okay? G for goblet cells. Okay? And letter E, external longitudinal bands or your teniae coli. So these are the features of your, okay, large intestines. Okay? So that is the mnemonic. Okay? So let's go to the liver. Okay? Your liver is the largest visceral organ and the largest gland in the body. Okay? Largest visceral organ and largest gland in the body. Pero if it's largest organ of the body, okay, largest organ of the body, it's the skin, ha. Okay, this was asked, no, largest organ of the body, skin ang sagot, no? In our surgery exam, no? Doon siya tinanong. Okay, largest organ of the body, skin. Pero largest visceral organ, okay, largest organ inside the body, it's the liver. So the liver is divided into right and left lobes by the falciform ligament. Okay, by the falciform ligament. So this is your liver. Okay, this is your falciform ligament. Okay, so you will have a right lobe and a left lobe. So your falciform ligament is a two-layer fold of peritoneum, okay, which ascends from the umbilicus to the liver. So this is attached to the abdominal wall, no? It was asked, no? The ligament of the liver that is attached to the abdominal wall, it's the falciform ligament. Inferiorly, it has a free edge, okay, which is known as the ligamentum teres, okay, which is a remnant of your left umbilical vein, okay, left umbilical vein. Superiorly, your falciform ligament is continuous with the coronary ligament, okay, and it demarcates the area, okay, the bare area of the liver. Okay, bare area is a portion devoid of peritoneum. Okay, so it lacks peritoneum. Okay, and your coronary ligaments, okay, will unite to form the triangular ligaments. Okay. So this picture na, this is the falciform ligament. This is the ligamentum teres hepatis. Okay, this is the coronary ligament. Okay, anterior fold and posterior fold. Okay, so the portion in between them, okay, that is the bare area of the liver. Okay, the blue part. Okay, that is an area devoid of peritoneum. Kaya pwedeng magkaroon ng infection dyan. Okay, sa bare area of the liver. So your anterior and posterior folds will join together to form the left and right triangular ligament. You also have another ligament, ligamentum venosum. So it's here, the venous ligament. Okay, venous ligament. Okay, it is a fibrous band that is the remnant of the ductus venosus. Okay, ayan, remnant ng ductus venosus. Okay, it is attached to the left branch of the portal vein and ascends in a fissure on the visceral surface of the liver to be attached, okay, above to the inferior vena cava. So basically, the ligamentum venosum is attached to your umbilical vein. Okay, okay, it attached the umbilical vein to the inferior vena cava. So it will bypass the liver. Okay, so this is the venous ligament. Okay, it divides the left lobe, okay, and the caudate lobe. Okay, so in terms of blood supply, arterial supply is coming from the hepatic artery. Okay, it also receives blood from the portal vein. Okay, and it is drained by the hepatic veins. Okay, and lymph drainage, okay, will be to the celiac nodes and posterior mediastinal lymph nodes. Okay, and the nerve supply is coming from the celiac plexus. Okay, we also have a famous, no, histologic and actually anatomic feature, no, the portal triad, which is contained in your hepatoduodenal ligament. Okay, within the hepatoduodenal ligament, you have the portal vein, okay, the common bile duct, and the hepatic artery. Okay, all of which will comprise your portal triad. Okay, so this is your hepatoduodenal ligament. Hepatoduodenal ligament. So this is the liver, this is the duodenum. Kaya siya hepatoduodenal ligament. Okay, what are the contents? The portal triad, okay, which includes the CBD, the portal vein, and the hepatic artery. Okay? So histologically, okay, there are differences. There are three described, okay, architecture of the liver. Okay? You have a classical hepatic lobule, you have a portal lobule, and a hepatic acynus. Okay? Let's describe each. Okay? Your classical hepatic lobule is polygonal. Okay? Actually, it is hexagonal in shape, no? Piatos, no? Para siyang piatos. Wherein, the central vein is in the center, okay? With the hepatic plates radiating outwards, okay? And in between the hepatic plates, you will see the hepatic sinusoids, okay? The portal area, okay, with the portal triad present in three corners of each hepatic lobule. Okay? Hexagonal now, sabi natin. So the central vein is in the middle. Okay? Hexagonal. Okay? Hexagonal. This is the central vein. This is the hepatic plates, yung green. Okay? And in between them are the hepatic sinusoids. Ayan. Okay? And each corner, okay, is composed of a portal triad. Okay? So that is a classical hepatic lobule. Okay? On the other hand, you also have a portal lobule. Okay? A portal lobule, okay? The central area is occupied, okay? The central area is occupied by the portal triad. Okay? So within the portal lobule, the blood flows from the center to periphery, while glandular secretion flows from periphery to the center of the lobule. Okay, your portal lobule will look like a triangle. Okay, sabi natin the center is the portal triad. Okay, so it will look like a triangle. The portal triad is in the center. Okay, the central vein, okay, is in the corners. Okay, so that is the portal lobule. Yan. Okay, and lastly, your hepatic sinus, okay, which is regarded by many as the true anatomical and functional unit of the liver. It is actually smaller, okay, and shaped like an ellipsoid, okay, or diamond shape, no? So you will have two central veins and two portal triad on each sides, no? Okay, and it emphasizes the pathophysiological aspect of the liver, no, because it classifies the sinus into three different zones. Okay, so when you look at it, asan siya? Ito siya, hepatic sinus, diamond, or ellipsoid joint. Ay, ellipsoid joint. Ellipsoidal, no? Halo-halo na. Ellipsoidal. Okay? It is divided into three zones. Okay? The zone 1, okay? The zone 2, orange. The zone 3, red. Okay? The zone 1, okay, if you look at it, it is closest to the vessels. Okay? Close to the vessels. Therefore, okay, maganda ang blood supply dito. Okay? Therefore, it is resistant to damage. Okay? Resistant to ischemia. No? Resistant to anoxia. Okay? However, if you have toxins, no, or blood-borne toxins in the blood, it is the one that is primarily affected. Okay? So anything with the blood, okay, it will be affected. Okay? Initially. Okay? Pero it is less prone to ischemia. Okay? The zone 2 is the middle ground. Okay? While your zone 3, dahil it is far from the blood vessels, it will be prone to anoxia. Okay? And it will be the last to recover from the damage. Okay? Kasi poor ang blood supply in these areas. Okay? So those are the zones of your liver. Those are the zones of your hepatic sinus. Okay? So now let's go to the gallbladder. Okay? So your gallbladder, okay, it's a pear-shaped sac lying on the undersurface of the liver. Again, do not forget, okay, the capacity, 30 to 50 ml. Okay? 30 to 50 ml. Okay? So your gallbladder has several parts. Okay? Starting with the fundus, no? Ito yung palpable. Okay? Rounded and projects below the inferior margin of the liver. Okay? It lies in contact with the abdominal wall at the tip of the 9th costal cartilage, right? Okay? So this is the fundus. Okay? The body, okay, which lies in contact with the liver. Okay? And the neck, okay, that is continuous with the cystic duct. Yan. So the fundus, the body, the neck. So sometimes you can have an abnormal conical pouch, which is termed as the Hartmann's pouch. Okay, so this part in the neck, no? Sometimes it is also called as the ampulla of the gallbladder. No, it is abnormal, no? Okay, and your spiral valves, okay, of Heister, you will see them in your cystic duct. Okay, to keep the cystic duct open. Okay, para mag-pass through yung bile, no? Pag naka-close ang sphincter of Oddi. Okay, your blood supply to the gallbladder, okay, is coming from a cystic artery, okay, which is a branch of your right hepatic artery. It is drained by the cystic vein, okay, draining into the portal vein. Okay, it is drained by the cystic lymph nodes, and the nerve supply is coming from your celiac plexus. Okay, another triangle, no? In your gallbladder naman, okay, is your cystohepatic triangle of Calot, or your hepatocystic triangle. Okay? So medially, it is bounded by the common hepatic duct. Okay? Inferiorly bounded by the cystic duct, and superiorly bounded by the inferior surface of the liver. Okay? This triangle, okay, may boundary, syempre may content, no? The content, it will be the cystic artery, okay, which supplies your gallbladder. Okay, now let's talk about the duct system. Okay, so let's start with your cystic duct. Okay, it has spiral folds to keep it open, constantly open, so that when the common bile duct is closed, no, pag close dito, okay, aakyat yung bile to be stored in your liver. Okay, it is a common site of impaction of gallstones. So this is your cystic duct. Okay, so this is your cystic duct. Okay? This is your right hepatic duct, left hepatic duct. Your right and left hepatic duct will form the common hepatic duct. Okay? Your common hepatic duct will join the cystic duct, okay, to form your common bile duct. Okay? Or ductus choledochus. Kaya ang tawag natin sa stone ng common bile duct is choledocholithiasis. Okay? It will descend behind the first part of the duodenum. Okay? And runs through the head of the pancreas. Okay, ayan siya, no? Runs through the head of the pancreas. Eventually, the common bile duct will join the main pancreatic duct. Okay? Ito yung main pancreatic duct to form the hepatopancreatic duct or hepatopancreatic ampulla. Okay? Your common bile duct, meron siyang sphincter dito. Okay? It is the sphincter of Boyden. Okay? Boyden. Okay? It is different from sphincter of Oddi, ha? Your common bile duct has its own sphincter, sphincter of Boyden. Okay? Okay? So, ayan, your CBD after it was joined by your main pancreatic duct, it will form the hepatopancreatic duct. So this part or your ampulla of Vater, okay, to eventually drain into the second part of the duodenum through the greater papilla or your major papilla. Okay? Your ampulla of Vater, okay, is guarded by the sphincter of Oddi naman. Okay? This sphincter of Oddi at your greater duodenal papilla. Pag CBD, sphincter of Boyden. Okay? So we're done with your liver, gallbladder. Let's go to the pancreas. Okay? Your pancreas lies largely in the floor of the lesser sac. Okay? In the epigastric and left hypochondriac regions. Okay? And it forms a part of your stomach bed. It is mainly retroperitoneal except for its tail. Okay? Mainly retroperitoneal except for the tail. So these are the parts of your pancreas. To start with the head, okay? It lies within the C-shaped concavity of the second part of the duodenum. Okay? This is your uncinate process. Okay? Projection of the lower part of the head. Okay? And lies behind the superior mesenteric vessels. Okay? And you have a tail. You also have a neck, body. Then you have a tail, no? Which projects to the spleen. Okay? Your pancreas has two ducts, okay? A main pancreatic duct and an accessory pancreatic duct, okay? Your main pancreatic duct is known as the duct of Wirsung, okay? Duct of Wirsung. Okay? So it will start at the tail. So ito siya, no? And then it will run to the right across the entire pancreas, okay? So from the tail to the entire pancreas, okay? And eventually to meet the common bile duct, okay, to form the hepatopancreatic ampulla of Vater, okay, to drain your major duodenal papilla. On the other hand, your accessory pancreatic duct or duct of Santorini, okay, it starts already at the head, no? Andito na lang siya, okay? Small portion of the head and body, and it will drain at the minor duodenal papilla. Okay, minor duodenal papilla. Okay, so those are the parts of your pancreas. Okay, so now let's discuss the blood supply of the gastrointestinal tract. Okay, to start, okay, so again, okay, these are the branches of your abdominal aorta, no? visceral branches of your abdominal aorta. Okay, so in summary, your celiac artery will be supplying the foregut. Okay, your celiac artery will supply the foregut. Okay, and that will cover the structures from the lower third of esophagus, okay, down to the second part of duodenum. Okay, celiac artery, foregut, okay, lower third of esophagus to the second part of duodenum. While your superior mesenteric artery will supply your midgut, okay, which will cover the second part of duodenum to the distal third of the transverse colon. Okay, so the distal third of the transverse colon. While your inferior mesenteric artery will supply the hindgut, okay, which will include the distal third of the transverse colon up to the upper half of anal canal. Okay, up to the upper half of anal canal. Okay? Ayan. Okay, so we'll discuss each of them. Okay? So your celiac trunk, okay, has three main branches. Your left gastric, splenic, and the common hepatic artery. So your left gastric has no further branches. Okay? Wala na siyang ibang branch. Okay? And will supply the lesser curvature of the stomach upper half. Okay? As mentioned kanina, no? Your splenic artery has three branches. The left gastroepiploic to supply the greater curvature, upper half. Your short gastric to supply the fundus. And some pancreatic branches, okay, to supply the pancreas. Your common hepatic artery, okay, has three main branches. The right gastric artery to supply the lesser curvature of the stomach, lower half. Okay, and your gastroduodenal artery, okay, which will further branch to right gastroepiploic to supply the greater curvature, lower half. Okay, and your superior pancreatico-duodenal artery to supply the pancreas and duodenum. Okay, and your hepatic artery proper to supply the liver and gallbladder. So this is your celiac trunk, no? Ito ang left gastric artery. This is your splenic artery, okay, which will give off a short gastric in the left gastroepiploic, tama? And pancreatic branches. Okay, this is your hepatic artery, okay, which will give right and left hepatic artery. And eventually will give off cystic artery. Okay, and then it will also give off a right gastric artery and a gastroduodenal artery, no? To give off a superior pancreatico-duodenal and right gastroepiploic artery. Okay, so that is the celiac trunk. Okay, actually ilang part na yun yung pinaka-complicated, no? Your superior mesenteric artery has 5 branches. Okay? Your inferior pancreatico-duodenal will supply the pancreas and duodenum. Your middle colic will supply the transverse colon. The right colic will supply the ascending colon. Your ileocolic artery will supply the ileum, the cecum, and you have an appendicular artery, no, to supply the appendix. So the blood supply to the appendix will be coming from your ileocolic artery. And lastly, your jejunal and ileal arteries. Okay? So this is your superior mesenteric artery. Ayan. Okay, this is your right colic. This is your jejunal and ileal arteries. Okay, better appreciated in this picture. Ayan. Superior mesenteric. Okay, this is the middle colic artery to supply the transverse colon. This is the right colic to supply the ascending colon. This is the ileocolic to supply the ileum, cecum, appendix. Okay, the jejunal and ileal arteries. Okay, so that is your superior mesenteric artery. So, okay, lastly, okay, your inferior mesenteric artery has 3 branches. Okay, your left colic, okay, to supply the distal third of the transverse colon, okay, and the descending colon. Okay, your sigmoid artery will supply the descending and sigmoid colon, and the superior rectal artery will supply the rectum and upper half of anal canal. Okay? So this is your inferior mesenteric, no? What are the branches? Left colic, yan. The sigmoid arteries and the superior rectal arteries. No? To supply the transverse colon, descending, sigmoid colon, rectum, and anal canal. So that's the blood supply of your GIT. Okay? In terms of venous drainage, okay, majority will drain to the portal vein. Okay? Other books may term this as the hepatic portal vein. Okay? Or hepatic portal vein. Okay? It drains the blood from the abdominal part of the GIT, okay, which will start from the lower third of the esophagus up to the upper half of anal canal, as well as the spleen, pancreas, and the gallbladder. Okay, your portal vein is formed by the union of superior mesenteric and splenic vein, okay, which occurs behind the neck of the pancreas. Although it carries a less deoxygenated blood, okay, it contains, okay, nutrients, no? And in fact, it carries 3 times as much blood as the hepatic artery, okay, to the liver. Okay? So, asaan ang portal vein mo? It's here, no? It's the portal vein. Okay? And as mentioned, it is formed by the union of splenic vein. Ito. Splenic vein and the superior mesenteric vein. Okay? Superior mesenteric vein. Yeah. So, what are the tributaries? Okay? So, it will receive blood, okay? Highly nutritious blood from the splenic vein, from the inferior mesenteric vein, from the superior mesenteric vein, the right and left gastric veins, and your cystic veins. Okay? And, okay, we important to mention the portocaval anastomosis, no? So when there are cases of portal hypertension, no, you will look at congestion of these structures, no? So there is an anastomosis between the left gastric vein and the esophageal vein, between the superior rectal vein and the middle and inferior rectal vein. Okay? So in this part, pag nag-congest, you will see esophageal varices. Okay? In your superior rectal vein and middle and inferior rectal vein, you will see hemorrhoids. In cases of portal hypertension, okay, the anastomosis between the paraumbilical veins and epigastric veins. So you will see there caput medusa. Okay, and there is also an anastomosis between retroperitoneal veins. Okay, draining the colon, and renal, suprarenal, and gonadal veins. Okay, so these are the anastomosis. Okay, so left gastric vein, okay, forming esophageal varices. In here, your superior, middle, and inferior rectal vein, okay? In cases of portal hypertension, it will present as internal hemorrhoids. Okay, and your paraumbilical veins, okay, will form caput medusa. Okay? So that's, okay, the portal venous system. Okay, now, let's go to your kidneys. Okay? Your kidneys are reddish brown grossly. Okay? And it is retroperitoneal in location. Retroperitoneal. Okay? It is slightly lower. The right kidney is slightly lower than the left. No? Why? Because of the right lobe of the liver. Okay? The right is slightly lower because of the liver. Si liver na naman, no? Ang may kasalanan. Okay? On your medial part of each kidney, you will appreciate the hilum. No? It is a vertical slit on the medial concave border of each kidney, okay, bounded by the thick lips of renal substance, okay, and extends into a large cavity called the renal sinus. Okay, so this is the arrangement, okay, from anterior to posterior. Okay, so you have first a renal vein. followed by two branches of renal artery, followed by the ureter, okay, and the third branch of the renal artery. Actually, this part is hindi masyadong anatomically correct. No? Mas correct dito, no? Kasi most anterior, no, is the vein, followed by the artery, and then ureter, followed by another branch of the artery. Okay? Mas correct yung nasa nandito. Okay? So this is the renal hilum, no? The medial concave part. Okay? Where the vessels in the ureter enter your kidneys. So your kidneys, okay, has several coverings, okay? So the immediate covering is a fibrous capsule, okay? It surrounds the kidney and it's closely applied to its outer surface. Okay, so the closest covering is the fibrous capsule. It is followed by a perirenal fat, okay, a perirenal fat, okay, followed by a renal fascia, okay, which will now contain the suprarenal glands. Okay, so kasama na si suprarenal glands. Your renal fascia is continuous with the fascia transversalis. Okay, so after the renal fascia, you have a pararenal fat, okay, which forms part with the retroperitoneal fat. So this is the kidney, okay. Immediate covering is a fibrous capsule, no, or your renal capsule, covered by perirenal fat. Okay? It is followed by renal fascia, which will also cover the adrenal glands. Okay? And then, further covered by the pararenal fat. Okay? So, those are the protection, no, of your kidneys. Okay. So, grossly, your kidneys is divided into two parts. The cortex, which is the outer layer, dark brown part, and it will contain the renal corpuscles in the proximal and distal convoluted tubules. So this part, no, the dark brown part, is the cortex. Okay? It is followed by a medulla, the inner brown part, okay, which will contain the loops of Henle and the collecting tubules. So cortex, medulla. Okay? And you also have a renal pyramid, no? Renal pyramid, okay, which is comprised by the medulla, okay, wherein its base is projected towards the cortex, okay? So this is the base. This is one renal pyramid. Okay? At the apex of the pyramid, you will appreciate a renal papilla. Okay, ayan, renal papilla. Okay, at the apex of the pyramid. Okay, and in between renal pyramids, okay, are extension of the cortex, okay, known as the renal columns. Okay, in between the pyramids, renal columns. Okay, sometimes, okay, merong ka makikitang striations at the renal cortex. Ayan, parang mga yan, no? Those striations are called medullary rays. Okay? So, they extends from the bases of the renal pyramids into the cortex. Yung mga striations. Okay? Those are your medullary rays. Okay? And you also have the renal pelvis here, no? It is the upper expanded part of the ureter, okay, which further subdivides into major calyces, okay, and minor calyces. Okay? So, that's the parts of your kidney. Okay, in terms of arterial supply, it receives blood supply from the renal artery. Okay? Important to note the sequence, no, of the blood flow. Okay? So starting from the renal artery, it goes to the segmental artery, to lobar arteries, followed by interlobar arteries, okay, going to arcuate arteries, interlobular arteries, to the afferent glomerular arterioles, okay, and then eventually to the glomerulus, then efferent, okay, and then going now to the venous part of your circulation. So it is drained by the renal vein, which directly drains into the inferior vena cava, okay, and the lymph drainage is coming from the lateral aortic lymph nodes, and the nerve supply is coming from the renal sympathetic plexus. Okay, so after the kidneys, okay, we'll discuss the ureter. Okay? It is a muscular tube that begins at the renal pelvis and connects it to the urinary bladder. Again, kasama siya sa dudes, no? Si ureter is also 10 inches, no? 10 inches din siya. Okay? And just like your esophagus, it also has three constrictions. Okay? So, first at the uretero-pelvic junction, second as it crosses the pelvic brim, okay? And lastly as it enters the bladder wall, okay? Or your uretero-vesicular junction. Okay, asan yung mga constriction? First, at the uretero-pelvic junction. Second, at the pelvic brim, no, as it crosses the pelvic inlet. And third, as it enters the bladder, okay, or uretero-vesical junction. So, what's the course of your ureter? Ano siya? Accountancy, no? Charot. Okay? So, your ureter enters the pelvis, okay, by crossing the bifurcation of the common iliac arteries. Okay? So, ito siya, no? So, from the kidneys, renal pelvis, magiging ureter. Okay? Ayan, no? And then, at the pelvis, it will cross the bifurcation ng common iliac arteries in front of the SI joint. Okay? And eventually, at the level of the ischial spine, okay, it will run forward to enter the bladder. However, before it enters the bladder, no, in males, so near its termination, it will be crossed by the vas deferens. Okay, so this is the ureter. Okay, ayan, kukross pa yung, papatong pa, no, yung vas deferens, no, bago siya makarating at ma-pierce niya yung bladder. Okay? So, yan ang mga hadlang bago makarating ang ureter sa urinary bladder. Okay? So, just like your esophagus, no, itong ureter mo has 3 blood supply. Okay? Venous drainage, okay? And venous drainage, okay? So, your blood supply will be coming from your, at the upper end, no, will be coming from your renal artery, drained by the renal vein. Your middle portion is supplied by the gonadal artery, drained by the gonadal vein. And your lower end is supplied by your superior vesical artery, drained by your superior vesical vein. Okay? And it will be drained by the lateral aortic nodes and iliac nodes. Okay? And supplied by the renal, testicular, and hypogastric plexuses. Okay? So, important to take note, no, that the ureteric pain is referred at the ipsilateral lower quadrant, okay, especially to the groin or inguinal region. So, some patients na may urolithiasis, no, they present with pain at the inguinal region in right lower quadrant. Akala natin appendicitis, no? Ito lang pala, no? Ureterolithiasis lang pala. Urolithiasis, no? So, ayan. So, dito nag-radiate ang pain ng ureter. Okay? So, your adrenals, no? On top of each kidneys, okay, are your adrenals. Okay? They are yellowish retroperitoneal glands that lie on the upper poles of the kidneys. Okay? And kasama siya sa renal fascia, no? It is covered by the renal fascia. Okay? It has a cortex as well and a medulla. Okay? So, this is your left adrenal. This is your right adrenal gland. Okay? Your left adrenal gland, okay, shape is crescentic or semilunar, okay, and extends along the medial border, okay, of the left kidney, okay, while your right adrenal gland is pyramid in shape. It is pyramid in shape, okay, and it is located at the upper pole of the right kidney. Again, left adrenal crescentic, right adrenal pyramidal. Okay, so your adrenals, okay, adrenal hilum, okay, will allow entry and exit of the veins and lymphatics. So at the hilum, what we will see are just the veins and lymphatics, okay? You will not see arteries and nerves at the hilum because, okay, the arteries and nerves enter the gland at numerous sites. Ayan, no? So, iba-iba siyang location, not only at the hilum, no? Okay, in terms of blood supply, it is supplied by inferior phrenic artery, aorta, and renal artery, drained by the inferior vena cava and the renal vein. Okay, and lymphatic drainage to the lateral aortic nodes and supplied by the preganglionic sympathetic fibers. Okay, histologically, each layer, you have a adrenal medulla, no? An adrenal medulla and a cortex. The inner layer is the adrenal medulla, which comprises the 10 to 20% of the glands. Okay, and there are two types of cells that we can see, no? The chromaffin cells and the ganglion cells. Okay, but what's important are the secretions. Okay, it secretes epinephrine, majority 90%, and norepinephrine. Okay, so merong question before, no? The adrenal medulla, the epinephrine and sabi sa question, no? Catecholamines are secreted at which part of your adrenal gland? Okay, so the answer there is adrenal medulla. Okay? So, one question na yun, no? Also ask, no, in anatomy din, no, are the layers of your adrenal cortex and the hormones that it secretes, no? So, your zona glomerulosa, okay, it is rounded pyramidal cells, okay, in irregular ovoid clusters, no? Parang glomerulus, no, round. Okay? It mainly secretes mineralocorticoids, specifically aldosterone. Okay? Natanong na before, no? Your zona fasciculata, so meron kang fascicles, no? Straight cords. It also happens to be the thickest layer secreting the glucocorticoids. While your zona reticularis, okay, the innermost layer, the thinnest layer as well, composed of short anastomosing cords, okay, which secretes androgens, DHEA, and androstenedione. Okay? Natanong na din before, no? Hindi pa natatanong, ito, no? Si zona fasciculata. Okay? So, that's it about your adrenals. Okay, now, so let's go to your plexus that is located in your abdomen. Okay? So, that is your lumbar plexus, no? It is formed in front of your psoas muscle. Okay? And again, no, sabi natin kanina, pag plexus, it will be formed by the anterior ramus or your ventral ramus. Okay? This time, your lumbar plexus is L1 to L4. Okay, this time, okay, kaya natin siya i-drawing, no? Unlike your cervical plexus. Okay, so your lumbar plexus is actually coming from L1 to L4, no? Pero yung illustrations in your book, they include T12 and L5, no? Your T12 will form your subcostal nerve, okay? Your T12 is subcostal nerve, okay? Your T12 to L1, okay, will join to form your iliohypogastric nerve. Okay, T12 to L1 will form the iliohypogastric nerve, while your L1 will become your ilioinguinal nerve. Okay, L1 is ilioinguinal nerve. Your L1, L2 will form the genitofemoral nerve. Okay, L1 to L2, genitofemoral nerve. Okay, your L2 to L3, okay, will form the lateral femoral cutaneous nerve. While your L2 to L4 will be obturator and femoral nerve. Okay, both of them are coming from L2 to L4. Okay, recently asked lang, no, your femoral nerve roots, okay, it's coming from L2 to L4. Okay, and your lumbosacral trunk is coming from your L4 to L5. Okay, kaya siya lumbosacral trunk, okay, yung L4, L5, okay, they do not participate in your lumbar plexus. Instead, they will go to the sacral plexus, no? Humihiwalay, no? Ito ang mga NPA, no, ng mga ng lumbar plexus, lumbar nerve roots. Okay? So your L4, L5 will form the lumbosacral trunk to join your sacral plexus. Okay? So ayan, no? This is the actual picture of your lumbar plexus. Okay? And derived from your Snell, okay? Your iliohypogastric nerve, okay, is coming from, will supply your external oblique, internal oblique, transversus abdominis, okay? And as well as the hypogastric region of your abdomen and buttocks, okay? So, those are the parts that is supplied by your iliohypogastric nerve. Your ilioinguinal nerve will supply the same muscles, no? Abdominal wall muscles, as well as the skin at the upper medial thigh, the root of the penis, scrotum, mons pubis, and the labia majora in females. Your lateral femoral cutaneous nerve, okay, as the name implies, it will supply the lateral surface of the thigh. Okay? Your genitofemoral will supply the cremaster muscle, okay, and the skin over the anterior surface of the thigh. Okay? It is a nervous pathway for cremasteric reflex. Okay? So, the sensation, okay, coming from the anterior surface of the thigh, okay, will pass through the the femoral part of the genitofemoral nerve. And then, the motor part will be the genital part ng genitofemoral nerve, which will supply the cremaster muscle. Okay? Your femoral nerve, in general, will supply the anterior compartment of the thigh. So, muscles there. Okay? And distal branch niya is the saphenous nerve. Okay? To supply the medial leg and foot. Your obturator nerve will supply the medial compartment of the thigh, muscles, and skin. Okay? While your segmental branches will supply the quadratus lumborum and psoas. Okay? So that ends your abdomen. Okay? So we'll go to the pelvis and perineum. Okay? So to start, okay, we'll discuss the bony pelvis. So far, favorite din tong question, no? The questions about the pelvis. Okay? So your pelvis is a basin-shaped ring of bone, okay, composed of the two hip bones, the sacrum, and the coccyx. Okay? So your pelvis is divided into two by your pelvic brim. Okay? And your pelvic brim has components. Anteriorly, the symphysis pubis. Laterally, the iliopectineal lines. And posteriorly, the sacral promontory. Okay? So anything that will be above the pelvic brim will be called will be included in your false pelvis or greater pelvis or pelvis major. Okay? Anything below will be part of your true pelvis, no? Or your minor pelvis, lesser pelvis. Again, no? So false pelvis above the pelvic brim. Okay? It is expanded part of the pelvis that forms part of the abdominal cavity. Okay? So this is your bony pelvis. This is your pelvic brim, no? Symphysis pubis, iliopectineal lines, sacral promontory. Okay? So anything above is part of the false pelvis. Anything below will be part of your true pelvis. Okay? So your true, lesser, or pelvis minor, okay, below the pelvic brim. Okay? This time, okay, the contents are part of the intestinal tract, urinary tract, and organs of reproduction. Okay? So your true pelvis, okay, has an inlet, okay, and has an outlet. Okay? So pelvic inlet or your superior aperture, and your pelvic outlet or your inferior aperture. Okay? So your superior inlet, superior inlet, halo-halo na, no? Your pelvic inlet, okay, if you look at it, it is similar to your pelvic brim, no? Same structures as your pelvic brim. While your pelvic outlet, okay, consists of the coccyx, the ischial tuberosities, sacrotuberous, sacrospinous ligaments, and the pubic arch. Okay? So this is the outlet na lang, no? Coccyx, the ischial tuberosities, and its associated ligaments, and your pubic arch. Okay? So, now, there are differences, no, between male and female pelvis. This part, you really need to know. Why? Tinatanong siya sa anatomy. Tinatanong siya sa legal medicine, no? How will you differentiate an autopsy of the pelvis kung male or female? Tinatanong rin siya sa OB, no? How to differentiate male and female pelvis, no? Pelvis anatomy. Okay? And more importantly, tinatanong na rin siya, no? In the past 4 years ata of board exams, no? How to differentiate the male and female pelvis. Okay? So this has a table. Okay? Your false pelvis in female is shallow. Okay? The inlet is oval. While in males, the false pelvis is deep and heart-shaped ang inlet. Okay? The cavity in females is wider and the outlet is larger, no? Because you need the space, no, for the baby. And you need the outlet to be large para makalabas si baby. Okay? So, smaller in males, okay? Ang smaller cavity and smaller outlet, no? Wala namang lalabas sa males, no? Your sacrum is short, no? Para hindi makasikip, no, sa baby. It is wider and flat, less curved. While in males, it is larger, thinner, and curved. Okay? The pubic arch is rounded and wider. Okay? And the ischial spine are everted. Okay? While in males, it is inverted. Kailangan everted, no? Para hindi contracted ang iyong pelvis. Okay? There are also different types of pelvis, no? Aside from male versus female, meron pa tayong different types, okay? You have a gynecoid type, okay? This is typical of female pelvis. Ayan. So, wherein the inlet is rounded and oval shape and wide ang transverse diameter. Okay? This is perfect, no? For pregnancy. Okay? You have an android type, no? This is usually in males, funnel shape, no? As you see, heart shape ang inlet, okay? And the outlet is contracted, no? So, not good, no, for pregnancy, okay? Your anthropoid, okay, has a long, narrow, and oval shape, no? Ito naman, pag ganun, no? Oval shape, no? Kung pansin nyo, siya lang yung medyo naiba yung transverse diameter, no? Mas narrow ang transverse diameter compared sa other types. Okay? While your platypeloid, okay? So mas haba, no? Mas malapad. Sorry, no? Mas malapad siya. Wider pelvis, flattened at the brim, okay? With the promontory pushed forward. Okay? Those are the types of your pelvis. Okay, let's go to the prostate. Okay? Prostate gland. Okay? So your prostate gland is a chestnut-shaped fibromuscular glandular organ surrounding the prostatic urethra. Okay? It is the largest of the accessory glands, okay, of the male genitalia and functions to secrete, okay, numerous substances like your PSA, prostaglandins, citric acid, and the acid phosphatase. Okay? It is also responsible for the odor of the semen and it is responsible, no, for the alkalinity of your semen. Okay? That helps to neutralize the acidity in the vagina. Okay? In terms of relations, so this is your prostate, na? Ito yung prostate. Okay? Superiorly, ayan ang neck of the bladder. Okay? Inferiorly, okay, this is your urogenital diaphragm. Anteriorly, you will have the symphysis pubis in the retropubic space. Okay, not seen in this picture na. Okay, and posteriorly, you have the rectal ampulla, the rectum, and the rectovesical septum or your Denon-Villiers fascia. Okay, so posteriorly. Laterally, you have the levator ani muscles. Okay? Okay, so your prostate, okay, has several lobes. Okay, it is named in relation to your urethra. Okay, you have an anterior lobe or isthmus, no? This is your anterior lobe. Okay, it is non-glandular, devoid of glandular tissue. Okay? So, paano ko maalala, no? Ang inisip ko, no? Anterior lobe, alang glands yan. Alang glands, no? Si anterior lobe. Okay? Your median lobe or your middle lobe, ayan, dito siya. Okay, so, ito siya, no? Your median lobe or your middle lobe, no? It is the portion prone to BPH, the median lobe, no? prone to BPH, it is the median lobe or middle lobe. While the part prone to your cancer, no, prostate cancer is your posterior lobe. Okay? Posterior lobe for cancer, middle lobe for BPH. Okay? While your lateral lobes, okay, it provides the main mass of the gland. Okay, in terms of blood supply, it is supplied by your inferior vesical and middle rectal arteries. Okay, and drained by the prostatic venous plexus to the internal iliac veins. Okay, the lymph is drained by the internal iliac nodes, and the nerve supply is coming from the inferior hypogastric plexus. Okay, so in your prostate, histologically, there's one feature, no? For sure, na-encounter nyo na before, you have a corpora amylacea. Okay? It is laminated prostatic concretions, no, in the lumen. Okay? It is composed by glycoproteins and other substances, no? So this is your corpora amylacea. Okay? They increase in size and number and calcify with age. Okay? So this part, ayan, corpora amylacea.